Welcome to the Genetic Genius podcast, where we explore the latest in genetics, reproductive health, and wellness. I'm your host, Dr. Lulu, and today we have a special guest, Dr. Fiona Tassoni. Fiona is a registered doctor of Chinese medicine specializing in fertility, with over 21 years of medical practice and more than 32,000 hours of clinical experience. She's also a fertility coach, founder of the Pregnancy Accelerator Program, and has a master's degree in Chinese Herbal Medicine. Fiona focuses primarily on women's reproductive health, including infertility, both natural conception and IVF assisted, pregnancy, preparation for birth, labor, and postnatal care. She also works with an array of complex health disorders such as endometriosis, ovulatory disorders, and polycystic ovarian syndrome, or PCOS, and that's just to name a few. Today, Fiona will be sharing her insights on fertility treatment and answering the question that many couples ask themselves: when is IVF really necessary? And as an expert in the field, Fiona has an empathetic and compassionate approach to finding a person's or couple's tailored health solution, working intuitively and from a completely integrated perspective. We are thrilled to have Fiona join us today. So let's dive right in and explore the myths and facts surrounding IVF and fertility treatment. Welcome to the show, everyone. I'm so excited to have my guest today, Dr. Fiona Tassoni. Welcome, Dr. Fiona.
Thank you for having me on your show, Dr. Lulu. I'm excited to be here.
Yay,
all the way from
me
Australia.
Too. Yes, thanks for tuning in from the other side of the planet. And you are a registered doctor of Chinese medicine, specializing in fertility. That's going to really guide our conversation today, which is, I love having experts on the show talking about fertility because it's a huge topic. Like, I think we're in an epidemic really when it comes to fertility, but I think we're really expanding people's minds and they're helping our guests really to learn about it's not the end all, well, it's not the end of the world, I should say. We literally is that there's lots of solutions to that.
Our fertility is declining, and I think that people are unaware of how serious it is across the planet, because before we used to focus 20 years ago, when I first started practicing, we used to focus largely on the female. But what we're seeing nowadays is these declining sperm counts. All the parameters of the sperm are really below suboptimal levels. And it's not just with humans, it's in the animal kingdom, it's everywhere. And it's in our food chain, it's in the water. It's like it's affecting all of us. Now, when I'm working in fertility, it's 50% the male, 50% the female, and then the 30%, which is the unknown.
There's always the unknown factor.
There's always that unknown factor. Absolutely.
Yes. Wonderful, Dr. Fiona. So before we dive into our amazing fertility conversation today, I'd love for you to just talk a little bit about yourself and like your background, especially from that Chinese medicine perspective, and how you got started in what you do and your passion.
Yeah, I got started in Chinese medicine through an injury that I had when I was 15. I had a back injury from a water skiing accident, and I had a posterior bulging disc, which affected my quality of life for many years, like about 6 years. And I was living in London at the time, doing what all Aussies do, traveled the world, and we used London as a base for travel, had the 2-year working visa. And through my exploration, I tried acupuncture and Chinese medicine as an alternative to helping me with my pain, because I couldn't find an osteo in London, and I had a chiropractor and osteopath in Australia. And so I was just walking past this little place in Tottenham Court Road off in London, and it was a little acupuncture clinic that said acupuncture for back pain. I saw the sign, and it was serendipitous. I looked up and went, I need to try this. It was just one of those sliding door moments that changed my life, because I had the first session decreased my back pain by 50%. And bear in mind, I had been suffering with chronic pain for 6 years every day. It was quite debilitating, with varying degrees of intensity. By the second session, my pain had completely gone.
Wow.
Now, I couldn't understand. I couldn't believe how, yeah, and if you look at what chronic pain does to your mood, your stress levels, I was just always I guess borderline melancholy. I probably nowadays would have been prescribed antidepressants, but wasn't the pathway that I wanted to go down. All of a sudden, all my mood changed from being out of this prison of pain. It gave me this a spark of interest. I started reading everything I could read about Chinese medicine and the art, and didn't realize that this lineage of medicine went back eons of time, like 10,000 years, if it depends what text you're looking at. Most of them will say anywhere between 3,000 and 10,000 years old. And when you look at the scheme of Western medicine, it's only 200 years old. It's relatively young. So I was just thinking, wow, this is like working with dinosaur energy. It's so ancient. And it's just, and like some of the prescriptions, for example, that I use today are based on formulas that were 2,000 years old, and I'm still prescribing them today and making variations on those formulas, such as Wenjing tongue, which we use to warm the menstruation in this fertility process. Now, that's a 2,000-year-old formula. So I was really resonant with the medicine. It gave me the premise to come back to Australia and study it as a mature age student. And I started my path towards Chinese medicine from my own experience with it. It was miraculous.
I
Never
love
in my
that.
life did I think I would be prescribing herbs or sticking needles into people.
You never know what's going to happen in our life. And that's such an amazing story, Dr. Fiona, about really how your own body gave you the message, right? To search out a different alternative. And acupuncture, I hands down believe in acupuncture, and I'm using it right now in treatment with myself from an injury, and not just for injury, right? As we know, and we're going to talk about today, how it can be used in enhancing fertility, which is great. And so let's talk about, I'd love for us to like back up and talk about IVF as like this jump in to our conversation today, because I think that is a place where a lot of women are curious about, or couples in general, curious about IVF. So in your opinion, when do you really feel like IVF is necessary? And when do you believe like couples should really start exploring that alternative fertility treatment?
Yeah, it's a very good question, because I find if you've been trying to conceive naturally for 6 months without any help, and then it would be, let's try and add some other things into this process. It could be naturopathic herbs. Let's take some, I'm a big fan of, regardless of what your process is and what adjunct you add to it, I think that you need to do a preconception phase. That's 90 days, 3 months. Everyone needs to give themselves 3 months of a detox, a cleanup, take a preconception multivitamin with folate. And then if you try that for 6 months and you're not having any success, then I would be exploring alternative measures such as IVF, or adding Chinese medicine or naturopathic herbs, or dietitians to the process, kinesiology, any form of energy medicine that might help you. So IVF for me has always been one of those last end results that it's the end of the road, whereas I feel like it's the first option most people will explore when they don't realize that there are alternative holistic therapies that can help them. So after 6 months, you might want to try for another 6 months, adding in kinesiology, naturopathic herbs, acupuncture, Chinese herbal medicine, whatever adjunct it in. It could even be reflexology, hypnosis, ISTD. It depends just what framework you're in, if you're cognitive, mental, physical, whatever the ailment is. So I would say give it 12 months is the long answer. 12 months of trying with some help in other domains. Then I'd be pursuing IVF as the last resort. Not a first
That's
resort.
great. Right. Yes, that's great, Dr. Fiona, and such wisdom, because I think that is so true. I think people, couples out there, they're frustrated, right? Maybe they've been trying, but they haven't really been trying. But I love what you said too about getting the body clear, right? From that detox place and working with that place, getting things moving in the system. What's blocking? That could be from that physical point of view. It could be from an emotional point, like you said, like doing some hypnosis. There's so many alternative therapies that we have right now available before jumping into the IVF expensive bandwagon.
Exactly. Look, and the thing is, IVF is not going to work if you haven't prepared your body. So I
Exactly.
have so many people that come to me, and that's why IVF doesn't boast a very high success rate, really, because people need to understand. And that's what my focus is with the work that I do. It's all about the preconception phase. Whether you're doing natural conception or IVF assisted, you still need to prepare the body. You need to lay the foundation. And
Mm.
those first 90 days, 88 to 90 days, those first 3 months are just so imperative to prepare yourself. And I find that every single patient, this is 99.99999, which is basically 100% of
Right.
people need to clean up the body. They need to declutter. They need to
Mm.
detox. We all have something that we need to fix. It could be
Mm.
even just our mindset. We need to reframe the way we think about things, because I have so many people that self-sabotage. They go into this process to fail, not to win. So I need to
Mm.
reframe a lot of the psychology. It's not just a physical component, it's the psychology, it's the spirituality. We're multi-dimensional human beings, and we need to prepare on so many different levels. And I think that's what people don't understand, is that once you peel off one layer, I use the analogy of an onion, something else might come to the surface. You clear the mind, and then something spiritually might come through. You may have some trauma memory as a 3-year-old that is blocking this process of feeling safe in your body. But the reality is, all I do in my work is allow the body to be safe, because pregnancy is about feeling safe in your vehicle. If your body's safe, then those embryos will inhabit and they will stick to that lining
Mm.
because they feel safe. If you're safe and you're happy and you're safe, your body's in a fertile state. So that's what I try to
So true.
encourage in my work.
Yeah, so true. Yes, that safety piece, because your body's not, if you're in that fight or flight mode, right? That sympathetic mode, your body's, hell no, this is not a time that I'm going to be getting pregnant or want to be pregnant, because your body's not, says this is not a safe environment for
No.
our relationship as parents, our relationship with the child, the environment, all those pieces. So yeah, I totally 100% agree with that the emotional component, having that piece is a way for you to really analyze, right? And declutter everything. It's like the nesting stage needs to happen like before.
Totally. Yeah, and I think that's what doctors are misinforming women. They are pushing women unnecessarily into IVF straight away without preparing and laying that foundation. So these women come into this IVF process with fear. They go, your eggs are old, your AMH is low. Every single patient I find, they get told this: you need to do IVF. You've got old eggs, your AMH is low, it's time to do IVF. Without saying, hey, let's take 3 months, because realistically, these doctors it's big business. They churn them out, and then that's why the success rate is so poor. So
Mm.
I find a lot of women are unnecessarily moving into IVF when they don't need to. You have to remember that nature takes its time. We don't watch the trees. If we just looked at nature, and trees don't just go drop those leaves, drop those plums, they
Let's
do
go.
it takes time. So I think that we need to slow down this fertility process. We're all in a hurry. We've all been living this Formula One lifestyle. We
Mm.
have short blacks, espresso, coffee, let's go. We need to drop the coffee, take a step back and relax, and just give
Mm.
yourself time
Mm.
to prepare. And that 3 months preconception phase, whether you do IVF or natural, it's just imperative that you prepare your body.
Yes, so true, Dr. Fiona. I love that. And when we're talking about the preconception phase, can you explain what this entails exactly, especially from like boosting the egg and sperm quality, why that piece is so important, and especially in relationships going into IVF and when you might not be needed?
Yeah, you will find that most doctors will tell you can't boost that. Now, in my experience in 20 years, I've seen that the body can change and correct itself. I have worked with patients in their 40s that actually have better quality than women in their 30s. Because if you look at it like this, we are born with all the eggs that we are ever going to release, right? And that is over 1 to 2 million eggs. We're born with those eggs. And those eggs were inside your mother, inside your grandmother. So they are pristine. They are perfect. They are primordial. They are divine.
Mm.
Now, what changes is the environment that those eggs start to work in. That's your internal environment. So once they start to mature, it's important that we have the right nutrition, the right blood flow to the ovaries, the right mindset, the right communion and love and intimacy with your partner. Like all of this matters. So then it's lifestyle factors. Are you smoking? All of these are going to affect the chi and blood flow. They're going to create more oxidative stress with your embryos and your egg quality and your sperm quality. We need to do a big cleanup. And so it takes about 3 months to reduce the caffeine, because caffeine affects the hormones. It creates a homocysteine environment, and our embryos need to have a really nice environment for them to heal and grow and evolve and divide, basically.
Right, exactly. Yes.
And I have so many toxic environments, so we have to clean up what's on the inside. Now, all of that can be fixed. So it means that just even taking a preconception multivitamin with the 400 micrograms activated folate, that would be the first thing I get people to do. Taking some omega-3 fatty acids, some vitamin D, just some basic things that you can start to do, and then start to look at your diet. Can I reduce my processed foods? Can I have whole grains and a rich variety of fruits and vegetables? Over 9 cups a day, I'm looking at 4. And a rainbow of colors. Most people are not getting a fraction of that. So that's
No.
why that's why I need to supplement with the preconception multivitamin. But yeah, diet plays a big role. But all of this can be fixed, and you can make simple changes. Even water intake. I find so many people are dehydrated. Now, we need water for your sperm quality. We need it for your
men.
yeah. And yeah, so people are dehydrated, they're full of inflammation and toxicity and oxidative stress. So we need that 3 months to fix up those lifestyle factors.
Yes, Dr. Fiona, so true. And I like how you brought in that whole piece about and the embodiment of the egg, right? From that generational piece, right? Is so important. How our family has been living over time. Maybe it can be we were living, I don't know, near a coal mine. Right. We can see different pieces of how that environment can then affect the quality of the egg, and the age can be a factor. Right. But I think that it seems like now in our world, we're really giving too much to that age factor in women in their 40s, calling it geriatric pregnancy, which I think is a horrible term for women in their
Don't get
40s.
me started on that one.
I know. So I think realizing from that genetic piece, I'd love for us to talk about that a little bit. How important is it? One, let's talk about like testing. Do you do testing with your patients from genetics in general, or what kind of testing do you recommend in that preconception phase from that Chinese medicine perspective? Do you look at labs coming in, or what does that look like for you?
Look, I like to fuse East and West. So I am not a purist in the Chinese medicine sense. So I have gleaned a lot of Western wisdom, and there is a lot of that. So I like to merge East and West together. So I do specifically prescribe, that my patients get labs. And I will start with something like a pelvic ultrasound as a start so that we can check things. I do a hormone panel so I can see what your hormones are doing. Even though I can see the fluctuations of your hormones in your BT charting, it tells me a lot of data. I still like to see the labs because I'm very data orientated, and we can tweak things quickly with nutrition and diet, and you can fix hormones very fast if I understand what's playing out. Some people have high prolactin, and it can be affecting their ovulation, and we have formulas, for example, in Chinese medicine called Liu Wei Di Huang Wan. It's a yin nourishing formula which helps lowers the prolactin. It's about understanding the labs and relating it back into a Chinese medicine format, and then we can fix the problems. Hormone panel is important. Blood is, in Chinese medicine, we say blood is the mother of all things. And so the blood is so important for nourishing everything, nourishing follicles, nourishing the lining, nourishing the blood flow, and that invigorating that blood circulation to the reproductive organs. So I need to know a complete blood count or a full blood examination. And I like to see what the ferritin stores are showing me. I like to see homocysteine levels. I then like to make sure that the thyroid is functioning well, because we need that
Right.
really functioning well in pregnancy. TSH, free T4. I like to do a full even with TPO antibodies. There are a lot of people that don't realize that they have these subclinical hypothyroidism, Hashimoto's thyroiditis, which can be picked up in that thyroid panel. But a lot of doctors don't test TPO antibodies, which is a marker for that autoimmune Hashimoto's thyroiditis. And then I can then tailor the diet to fix that problem. For example, if you had Hashimoto's thyroiditis, we remove gluten out of the diet because it elevates the antibodies. It's like coming off the oat milk, which has a lot of gluten in it. So there's quick fixes when I can see labs. So yes, I do labs. Then it's like you tier it. If somebody's got clotted periods, I might do some clotting. I might request some clotting blood tests to see if they have that. I'm always testing for the MTHFR gene mutation, because I find that 50% of women do have that gene. And if you do have that gene mutation, your ability to create healthy levels of active folate will be decreased. And we need folate. Folate is like king.
That's right. Or the queen.
Process. Well, the queen, it's the goddess.
The goddess energy and of helping with the development of the fetus, with the brain and the spine. It's so important.
Exactly. And it's like we need folate for the DNA of the mother and the child. We need it for stopping the homocysteine levels from climbing too high. We need it for the formation of red blood cells, white blood cells, and platelets. It's just so important. And also to avoid deformities like neural tubal defects and all different deformities that can happen. So that MTHFR testing is one test that I recommend. Now, that a lot of doctors don't recommend that, but you need to know 50 to 60% of the world population have that gene mutation.
I know, it's a crazy amount. And I love that you talked about all those different tests, Dr. Fiona. Those are so important because we want to have, especially in that preconception phase, have that baseline to see what's going on. If we want to do that before the baby is on the way, or during that developmental phase, to know, like you said, cleaning out the crap from the gutters, just really going through. And that panel can really help us to, like you said, see if there's an underlying thing that might be contributing to the lack of fertility, right, in that moment in time. Or maybe there's some things that need to be brought on to help the body return to homeostasis. And genetic testing is so important in that phase, because it could be, like you said, the MTHFR gene, which can decrease a lot of energy within the mother going through that birthing process. And also so important to see both sides, not just the mother, but the father in that genetic panel, right? It's important for the mom, of course, for taking folate, but also I love to see both of those panels together and see, okay, what's the father bringing in? What's the mother bringing in? Are there things that we can do to support the family, like as a unit, as they go into the craziness of having children, right?
Yeah, look, it's important. Like I prescribe a pregnancy multivitamin with 400 micrograms of activated folate and for women. It is important. You're so right. It is so important for men as well, this process. And then it's like, I'm also a big fan of then saying, all right, are you getting your activated folate in your food? Because remember, food is superior to any vitamin we can take, and we want that diversity with things like mung beans and spinach and quinoa and lentils and all your collard greens. And I love to use food as medicine. Chinese medicine is very big on using food as medicine. Let medicine be thy food and food be thy medicine. And I love that. Working with hormones, it's food and nutrition is such a big part of it in this preconception phase.
Oh yeah, totally. Hippocrates said it best, right? Yes, food is medicine. And it's so true that I think, and especially now that we're seeing such a change in the food in our environment, like what we can actually eat. And so that might be changing the way, like whether we're absorbing what we need, whether maybe it's something happening in the gut where we're not breaking down that food properly, which is very common, right? And estrogen is made in the gut as well. So it's like we can have all these different problems just stemming from the food if we're not eating the right food that we need.
Which is an interesting thing, Dr. Lulu. I often will start with a gut healing protocol
Mm.
because I just believe that microbiome is just so integral. If you fix it, then it means you're absorbing everything properly, you're methylating properly, you're not recycling those dirty estrogens, as you say. We've got to excrete them out of the body. Otherwise, they recycle back, and then we have problems with estrogen dominance, and that's a whole other story that we could
That's a
talk
whole
to.
other conversation. Exactly. Yes. Yes. But having a good input and then an output, I think, is super important. And that microbiome, I agree. Having a healthy microbiome is 100% like part of the
Yeah,
equation for all health, not
yeah.
just fertility, but all health in general.
Yeah, and it's not just about taking a probiotic. It's like understanding what are prebiotics and probiotics in our food. Prebiotics like artichokes and probiotics that we can eat using our sauerkraut and our kimchi and our kefir and miso
Mhm.
and tempeh and kvass.
Right.
I love food. I get so excited about food. My patients just go, "How can you be so excited?" I'm like a puppy dog. Like when I start talking about, I start salivating. And this is what I want from my patients. If they can understand what the food's doing, that they're
Mm.
mulching the garden, right? And we want all those microorganisms and bacteria to be feeding of it, because we need to understand we're more bacteria than we are human beings.
We're just a walking
We're full
blob of bacteria.
yeah.
Yes, so true, so true. And I love your passion around food, and it's so important. And I think we have seen such a change in that's like generational gap. I think a lot of during the 50s and 60s there was this whole microwave and well, no, the microwave wasn't then, but Betty Crocker in the States anyway, like making things like fast and quick and TV dinners. And then something happened where the children weren't taught how to make food. And so now we're in this place where it's like fast and I don't know really how to make anything. I don't even know how to like take those collards off the shelf. And what are they? I think it's reteaching the new generation. And that has a lot to do with fertility about bringing in that good food that they even learn. Oh, okay. How do I even make rice? It seems so simple, but it's true.
And that's what this preconception phase is all about. It's
Mm,
about unlearning and then relearning.
mm,
And so I feel like I'm a big educator with that. I love to teach people. That's why in my coaching, I will give them recipes and I break things down into the 4 phases of the menstrual cycle. What are we eating in the menstrual phase? What are
mm.
you eating in your follicular phase? What are you eating in your ovulatory phase? And what's the most important foods to be eating in the luteal phase? And I break them down and then I get the husbands to follow that format because they tend to cycle with us. Men
Exactly.
tend to cycle with us. The women are the leader of the pack, but men cycle with us. So it's important that they understand what the nutrition is doing for the hormones as well. Nutrition is a huge part of it. And when
Mhm.
people know, when you know better, you do better.
That's right. Yes, it's true. And you have fun doing it, right? Because you see the
Exactly.
results. So true. Now I know, Dr.
And
Fiona,
it's
that oh, sorry, go ahead.
yeah,
Yeah.
but and I think that's where people say to me, I just feel better, I'm sleeping better. When you get the fuel in the body, the body wants to heal itself. We are born, our bodies are this magnificent machine, it's this work of art. And when we
Mm.
put the right ingredients in, the body will heal itself.
Oh, that's so true. Yes. What goes in is when it's right, the right thing that's going in is can be so healing. And like you mentioned, even with hypothyroidism and gluten, that's another important reason why it's good to know what's going on at that cellular level. Because if we're putting in things that can be interacting in a specific way, maybe doing harm, right? We want to know that, especially in that preconception phase. Okay, maybe I shouldn't be eating that particular food group. Maybe I need to bring in things that are higher in iron because of ferritin labs showed that I needed more iron in my system. So it's so important, like you said. And I know that you also work with Dr. Fiona more complex issues such as endometriosis and PCOS. How do those impact, or what do you see can you discuss how those challenges can be associated with infertility and how can women navigate those when they're already coming into that preconception phase with some of those underlying conditions already on board?
Yeah. So with endometriosis, for example, you'll see lots of inflammatory markers, partly because you've got these cells that are growing in different parts of the body. The lining is growing out of in the pelvic cavity, creating lots of pain and inflammation. So there's this rise in prostaglandins. And so part of the strategy, and then as we get when it's inflamed, the energy gets stuck. So we see a lot of blood stagnation and inflammation with endometriosis. So part of the strategy, and this is where Chinese medicine is brilliant. Chinese herbal medicine is incredible for cooling the blood and moving that blood stasis, alleviating the pain. Clearly, if it is at a stage 4 and it needs to be excised, that's where it's the beauty of Chinese medicine works with Western medicine. After the excision, we can work on the healing and recovery. Chinese medicine can also help with fixing and cleaning up the diet, providing an anti-inflammatory diet, then looking at what body type is this person. Are they more a earth type that needs to nourish the spleen and stomach meridians? Are they, I might break it down into even like an Ayurvedic kind of understanding. Are you Vata? Are you Kapha? Are you Pitta? So if you understand what your body type is, and then we treat accordingly. But it's very similar. We'll take things out like dairy and gluten, things that are going to create inflammation in the body. Because dairy and gluten has the gliadin can create inflammation in the body with most people, processed. And when we can clean up the diet, endometriosis responds relatively well. We'll get you onto, for example, slow cooked foods that are cooked. Because if you think of the nature of cold and raw foods, it's cold. And what does cold do? It's contracting. So it's going to create more pain and blood stasis in the body.
Right.
So that's how Chinese medicine, and if your body is under any form of stress, and we see that as a stress in the body, then clearly your ability to conceive is diminished.
Yes.
Chinese medicine goes back to the root. We fix the pain, we move the blood, we cool it down, and we get your digestive system working properly, and then you can become more fertile. With PCOS, it's a metabolic disorder, so it can have high levels of insulin resistance and high levels of prolactin, which affect ovulation. So again, this is where we look at PCOS responds incredibly well to dietary changes in exercise. You can have huge impacts just with those two things alone. And it's not like I'm saying you have to do rigorous exercise, but with PCOS, it's like time on feet. Just walking, get your 10,000 steps in a day, even if you need to work up to that. But if you find something that you love, even if it's not walking, whether it's yoga, if it's bike riding, if it's swimming, I don't mind what it is. But we just get your body to move. With PCOS also, because it's under stress, because the body's trying to ovulate and everything's delayed, and you've got that insulin resistance, we have to work on that gut microbiome. So what I find that I focus on with PCOS is really starting to look at your macros, your proteins, your carbs, your fats. And I say, look at your plate and go, where's the protein? Where's the carbs? Where's the fat? So that then you're eating for your hormones to be balanced.
Exactly.
Right? Those 3 macros with the variety of all the other micronutrients, plenty of vegetables, plenty of fruits, your seeds and nuts, that like whole foods. Like you're not going to be starving with PCOS when you know how to eat. And part of it is that re-education. And then it's like looking at your stress levels, lowering the cortisol. Because if your stress levels are high with PCOS, your insulin resistance is worse.
Right,
so
exactly.
if we lower the stress, so it could be, again, energy medicine, acupuncture, kinesiology, reflexology, whatever it is, what's your boat that you enjoy, do those things that are going to calm the nervous system. Because if your cortisol is down, your ability to lose weight, and when you lose weight, your estrogen is metabolized and you naturally become more fertile. So it's a strategy. It's a simple strategy, but it works. The thing with PCOS, it just takes a bit of time to tweak it because there's so many moving parts with PCOS. So we need to get everything balanced. And that's the beauty of Chinese medicine, whether we're working with endometriosis or PCOS, it's getting the body back into that state of homeostasis. And what your body needs is different for each case, but that's the basic template for finding that balance with those two.
That's great, Dr. Fiona. Thanks for really explaining those in detail, because I think it's important, like you said, with endometriosis, to come from that mindset of inflammation, and PCOS too. They're both inflammatory, right? And so why is the body in that state of inflammation? And what can we do then to help the body decrease that inflammation? I love how you brought the cortisol and that stress piece for us to remember, right? How important stress is as a deterrent for actually getting pregnant, right? Because if we were seeing stress as rampant, I think a lot of people are just like,
Yeah.
how do I deal with it? It's such a chronic state now that people don't even realize they're stressed, right? You do a little stress quiz and they're like, check, check, check. I'm like, do you know you're stressed? And so I think people they just have become numb. And so that when we look at that piece, in regards to the hormones or infertility, we can say, oh, of course, if we don't look at that cortisol level and how to balance that stress, like you said, with mindset, kinesiology, acupuncture, naturopathic medicine, meditation, there's so many. The list now is growing and growing with all of our alternative resources and treatments and all the healers out there, which is great. I love that about our planet. It's really shifting to allow this other place of healing to begin.
Indeed. Yeah, look, even when I do acupuncture on my patients, they could come in, they don't even realize that they are wound up like a coil. And I can put first one needle in, the tears will start, and they just feel like they fall asleep. First of all, it might be the tears, and emotions can come to the surface when you do acupuncture. It's quite amazing to watch that metamorphosis. Excuse me. And then literally I find that their nerves just calm down, they fall asleep. And I have some patients walk out going, oh my gosh, I'm so exhausted. And that's when I explain to them that your body has been running on cortisol and adrenaline. And that's what happens when you do the acupuncture. It brings you back to your base level and you realize, wow, I've been operating in this stress state for so long.
Yeah, that's so true.
And stress is so insidious. We can't see it. It's invisible. You don't realize how stressed you are until you start to unpack it.
Right. You're
And
like
if you
all
are,
the baggage on the shelf. You're like, oh, there's that stress and that stress, finances, home, relationship, food, toxins, environment. You're like, oh, all those things are affecting me. I didn't even realize it.
yeah. And if you realize that stress, it's going to impact your fertility, we need to look at it. We need to understand it in all its varieties and reduce it. Because when you're not stressed, your body is naturally fertile. So if we take the stress out, there's the fertility.
Yes, so true. Yes. And I think that is a major component. And I think, as we were even just talking about the genetic factor, all those components affect the epigenetics, affect how our cells are working in the body, how they're behaving. And we're going to see a huge shift in our ability to feel amazing. But as far as conception goes, a real shift in that piece when we do stress management is a good term for it. I think it's really not, I don't even like that term. It's about really realizing how stress is in your life, what it is, and how to change your whole relationship with stress. And there's lots of resources out there. If you're tuning in, listening, there is so much about mindset. There's apps for helping for calming the body, and there was lots of resources that are free, right? So if you're like, oh, I'm looking for something, try YouTube too. YouTube's great. There's lots of great meditations to really help you to sleep better, reduce stress, but just get out and get some sunshine. Do a little exercise. That's a great stress reducer.
Yeah, I do a lot of breath work in my coaching too. I find that is just so powerful. I actually come from an Iyengar background, so I do a lot of pranayama and breath techniques. And I just find getting people to learn how to breathe into their lower abdomen, as if you watch a little baby, it breathes the belly. It's got that Buddha belly,
Buddha belly.
soft,
Yeah.
Buddha belly. And so I teach people how to do that lower diaphragmatic breathing. When you learn how to do that, it calms the stress immediately. So I get my patients to even just do one hand on the heart, one hand on the lower belly, and just make sure your chest is still, but let the belly rise and fall with the bottom hand. So that way you're calming instantly. You're calming the cortisol, you're calming the hormones, you're setting yourself up for sleep, and you're setting yourself up for recovery and repair. Because when you sleep, sleep is so important in this fertility process.
Because as soon as you have that baby, you're not going to be having much. So you want to make sure that you have all those sleep components really in complete alignment before you go in.
Absolutely, 100%.
Yeah, I think what's the statistics are like the whole first year, you don't really even sleep that much. And so it's like, we've got to not only during fertility and preconception phase is that it's so important to have sleep, but you also want to have the habits, like those really ingrained habits about what to do if you are feeling like you're not sleeping well, or maybe you need the support of your adrenal system, like you in Chinese medicine, supporting the yin system, right? And so as a way that when you're starting to feel so depleted, you're like, okay, I know what to do. I got the tools. I can call Dr. Fiona up, go get a tune-up, right? Or you can do something else to really help support the body.
Yeah, yeah, absolutely. You've got to look after all those parameters, really. It's so important. And I always say to my patients, when you learn this preconception phase, it's something that you can set up for the rest of your life. It's not just preconception. I want you to be able to do this for the term of your natural life, moving
Exactly.
forward.
Yes.
Yeah, when you know all these little tools of having your lemon water first thing in the morning with your apple cider vinegar, with a pinch of cayenne pepper for your heart health, your microbiome, your liver health. Like, this is something I want you to set up for life. We want to do these pillars and put them in place so that you can eat like this and feel your best version of yourself, not just to make a baby, but to have a healthy, happy, and long life.
Yes, so true, Dr. Fiona. Those foundations of health are so important. And we're not just like in that moment of preconception, but they're long-term foundation: water, nutrition, nutrients, some vitamins and minerals and supplements if you need it, sleep, stress, all of those foundations of health. And it's like our house, right? If we're only like on one leg of that foundation, the whole house is going to crumble to the ground. It's not a very good philosophy for longevity.
Yeah, we need to build a strong house
Build a
with a
strong
great
house.
foundation.
Yeah, so true. And that's why it's so important too to have the other person in the couple, right? It's not just about the person that is conceiving and carrying the baby through conception and through birth and labor, but the other person that's involved, whether it's a male or female partner, or if you're solo out there, you need to have those components of the foundation built solid.
It's a teamwork effort.
Yeah. So
Yeah.
if you're alone out there and you're having a baby right now, we're supporting you. We're sending you lots of love, and call out that support system, right? Call up your friends, your family, your parents, because you need that support system. You cannot something that you can do alone. Yeah.
Yeah, it requires a village to raise a child. We need to always remember that. And if you need help, we need to learn to ask for help, and that you're not weak by asking for help. It shows your greatest strength when you can ask and be vulnerable and have the support, because that's how we grow and evolve together.
Yes. Oh, 100% community, village. We have to have that. And I think we have lost that along the way, right? Because of maybe it's the tribal component that is shifted a lot, especially in the United States. We don't have that as much. And even neighborhoods where children are not going out and playing in the streets, right? It's like this whole shift of community. So going back to that community, especially as women, through that whole process of conceiving and going through labor, and after, knowing like, hey, you can call up your best friend, or you can even go hang out with a group of female, right? Group of that women's circle, like helping you through the whole process.
Like, even in Chinese medicine, we call it the fifth trimester, and it's the postpartum trimester. And it's something that doesn't get spoken about often. Those first 40 days after you give birth, that fifth trimester is so important. In Chinese medicine, we do a lot of mother roasting, which is I love the metaphor of mother roasting. We warm you up. Beautiful, nutritious soups and foods, and we use moxa. It's a herb called Artemis vulgaris, but it's a herb that we compress. It looks like a cigar, and we literally poke it down near the belly. We hover and peck towards the belly, not touching the skin. In the skin, it's got all
Right.
the
Yes.
cinders of a cigar. But it smokes and it smells a little bit like cannabis, to be honest with you, because it's very closely related to family. It's got this strong pungent smell, but it has the ability to warm and nourish the blood. It helps contract the uterus and helps the nipples lactate. So it's something that's so important to understand, that having that support postpartumly is really imperative from a nutritional perspective. Also, go and have some acupuncture and some mother roasting with some moxibustion, some heat therapy on your belly.
That sounds lovely. And it is, like you said, so important to have that support in that postpartum phase, emotionally and physically, because especially if you had a C-section, right? Your body has gone through labor in itself is so intense. But even if you have a C-section, you're going to have a way different stage of healing, right? You're going to need a lot more nourishing for your body and healing and downtime.
Yeah.
We're sending women back to the workforce way too early. They need that time to bond with the baby and to heal. And for the husband, we need that whole unit or wife, whatever it is.
And there's so much numbness that comes with that scar. In acupuncture, we will do scar needling, and we call it encircling the dragon. So we needle all around, break up all the scar tissue, and we get that chi and blood moving. So to encourage that healing process. And I think a lot of women that have C-sections don't realize that there are all these therapies around, like even castor oil packs and womb wellness strategies that you can use in your postpartum healing. But we don't know about it until we have these beautiful conversations of opening up this information.
Yeah, so true, Dr. Fiona. And there are a lot of great resources out there. And speaking of wonderful resources, I'd love for you to talk about some of the things that you're offering. Tell us about your 6-week preconception fertility masterclass, which just sounds amazing.
Yeah, now I've merged a new platform. It's a new group on school, and it's called Fertility Tribe for Women Over 40. And it offers you a 6-week free masterclass when you join the school platform. It's also I guess, a community of women that are going through the same struggles and trying to conceive over 40, particularly with that focus. But it's a masterclass that will educate you on how to conceive properly, all the things that we've spoken about preparing your body with nutrition, understanding the complications that might be coming up with the husband or with your partner, and the things that you can do, strategies, ways of eating, all the tools that you need to prepare for you and get your body ready for pregnancy.
That sounds great, Dr. Fiona. And we'll put the links for that all in the show notes. So if you're tuning in, you want to learn how to sign up for that, we'll have that in the show notes. And then also tell us about your fertility coaching program. It's a 12-week coaching program. And what is involved in that when you're working with your patients in that standpoint?
So during the 12-week program, it's a Zoom consultation, a 1-hour Zoom consultation that is a weekly consultation, but they have access to me via Skype. So I call it the cosmic umbilical cord, where they can talk to me 24 hours a day, 24 hours a day, and we often use voice memos, and I talk to them if I'm on different time zones. But basically, they can ask me anything that they're struggling with. In that time, what we do is I do a lot of BT charting, so I can map your cycle and understand the fluctuations of your hormones. I will prescribe Chinese herbal medicine and send it to your door based on your Chinese medicine diagnosis. And that includes the male. Remember, it's teamwork. So herbs get dispensed, and then it's literally using a lot of the strategies from that free masterclass and implementing them, honing in on what they need, what their particular issue is. So it's tailored particularly for what their needs are. Each couple has different needs. Sometimes it might be more of an emotional focus with holistic counseling. Other times it's very physical, and I've got things like PCOS or endometriosis that I need to fix and work with and get their body to an optimal state so that they're ready to conceive. But yeah, it's 12 weeks. And then I have a lot of patients, if they need to extend, some of them who may not be pregnant in that 12 weeks, they might extend for another 2 or 3 months.
Oh, that's great. And we'll put the links for that as well. And that's on your website, which tell us about your website and how people can find you and follow you. Have a Facebook group as well. So tell us a little bit about those things.
Yep, the preconception. I've got the fertility group, which is the Pregnancy Accelerator Program. It's for women over 40, and you can join that group. And in that Facebook group, you can ask me any question. I will have all your questions answered, and I find that that's my way of giving back. I love the Facebook group because we've got over 2,000 members now, and people from all over the world. I'm getting comments all the time. Thank you for helping me. I've learned so much from the questions that other women ask, and people that are struggling to conceive that have gone on to conceive. So beautiful testimonials there in that group. It's a beautiful community that we've built over the past 3 years. And so that's the Pregnancy Accelerator group. We've got the school group with the free preconception masterclass. And then I've got my website, pregnancyaccelerator.com and drfionatasoni.com. I'm also on Instagram, Dr. Fiona Tassoni. And that pretty much covers it all. I'm also on LinkedIn.
Great. Dr. Fiona, that's wonderful. We'll be sure to follow you on there to keep track of all your amazing fertility tips, tools, and health nuggets to help everyone along. And one last question as we're wrapping up today. If you had an unlimited budget right now, what would you do to make the biggest impact on our planet?
If you had the biggest budget, I would be looking at improving our quality of water. We have plastics in the ocean, the microplastics, they're affecting not just the fish, but it comes into our water systems and it's affecting our fertility. So my biggest budget would be to go into our waterways and removing the microplastics.
That's a great one. We so need that. So ding, like that one's definitely, let's bring that one in and manifest it sooner than later. Thank you so much, Dr. Fiona, for joining us today. I really loved our conversation. I learned a lot and I can't wait to share it with everyone around the world.
Thank you, Dr. Lulu. It's been an absolute pleasure. You're divine.
Thank you.